for coming out today to hear about the Ohio Hospital Price Transparency Act, which passed in December and becomes effective law of Ohio tomorrow, April 3rd, here in the state of Ohio. It's the finish line of a 2.5-year journey to fight for patients here in the state of Ohio. It means empowering Ohioans with clear, upfront information about the cost of medical care. And this is about giving patients the ability to make informed decisions, opportunity to shop for affordable options, and avoid surprise bills that can devastate families. When hospitals share their prices, it fosters competition and ultimately drives down the costs, which is why I'm happy to report that we did have unanimous bipartisan support in passing this. It's one of the best laws that we have here in the state of Ohio and really all across the country as it relates to health care. And I'll pass it along to my joint sponsor, Representative Tim Barhorst.
Thank you, Representative Ferguson. Representative Barhorst, representing Western Ohio. Got a lot of rural health care needs in Western Ohio, and this bill that we got passed, as Ron said, took us 2.5 years to get through, and it's going to provide a true free market in health care where the patients and their employer-sponsored plans can partner together to have transparency, link quality, and have better outcomes for their health care needs and their health care plans. The most exciting part about this is we have a future to drive the cost of health care, to flatten it or even lower the costs. 20% of the Ohio economy and the United States economy is related to health care. That is many percentage points higher than any other developed country. And I think with this bill, I think we can see improved outcomes. Like I said, and the transparency will include competitive pricing and a future for employers to come to Ohio, draw the employees they need, and those employees to get the health care they need when they need it at the right time, at the right cost. I appreciate your time. I wanted to introduce Marnie Carey. She's with Power to the Patients. Thank you.
What a great celebration today. Thanks to a lot of hard work, particularly on behalf of Representatives Ferguson and Barhorst, Ohioans no longer have to enter the healthcare system with a blank check. They no longer have to risk financial ruin in order to access health care. And they can stop putting off needed care for fear of getting blindsided by a bill they could not see coming. As president of Power to the Patients, I lead a national advocacy organization whose focus is to help Americans realize their right to know prices for healthcare up front. For Ohioans, that day has come. Thanks to the Ohio Price Transparency Act, which passed both chambers unanimously, healthcare consumers will be able to shop for healthcare the way they do everything else, by comparing quality and price. When prices are out in the open, hospitals will have to start competing on price, which will usher in competition, which will drive down costs. Once hospitals pull the curtains back on their prices and show them in dollars and cents, thank you, stories like the one I'm about to share will be far less common. 2 years ago, Tracy Owens, who lives in Norton, Ohio, and who works for Amazon doing packaging in a warehouse, needed surgery to repair an umbilical hernia. The otherwise healthy 48-year-old went to a hospital in Barberton to have the outpatient procedure. She was home in 4 hours. Tracy had good insurance through her husband's carpentry union. Heck, the couple pays $14,000 a year in premiums, not including what her husband's employer pays. She figured she wouldn't know much, right? No one told her up front what the cost would be. The hospital charged $14,500 for the procedure. Her insurance paid $11,700, leaving Tracy owing $2,800. Under the price-opaque system, she could not have known ahead of time that the hospital would charge her more than double the state average for this procedure, which in Ohio is around $6,400. Had she known, and now she does, she would have shopped and avoided medical debt. The kicker, after the hospital put her on a payment plan, which she religiously paid $115 a month payments for over a year, they upped the bill and added more than $700 to the bill to continue her owing, with no explanation. Real prices will not only empower patients to shop for value, but will also let them hold hospitals accountable for the prices they post. Change is here, Ohio. The secrecy and overcharges are about to end. Thank you for leading the country in this effort.
Well, good morning. Thank you. My name is Patrick Neville, and when I was asked to represent patient rights advocate, I was happy to agree. PRA does a terrific job representing the over 90% of Americans that agree we need healthcare price transparency. We would like to thank the original sponsors of the historic legislation that is being implemented tomorrow, Representatives Ron Ferguson and Representative Tim Barhorst, first and foremost. Although this issue is supported by 90% of Americans, legislators who take it head on are often vilified by the lobby corps and the powerful interest within a building like this. Today would not be possible without their altruism, tenacity, strategic thinking, and steadfast loyalty to their conscience and constituents. Gentlemen, your constituents are blessed to have you as representatives. Many other allies were supportive of this bill. Too many to name, but I want to mention specifically, since they're in the room with us, the American Legislative Exchange Council and Lee Schock, their Senior Vice President of Policy. Effective tomorrow, the state of Ohio will be empowered to show citizens hospital prices in actual dollar amounts, not estimates or algorithms. The governor's administration will no longer have to wait on federal government to create a functional market in healthcare. By allowing consumers to make informed decisions for themselves and their families, we hope the Trump administration will take action on it as the previous federal administration did not. We are confident that Governor DeWine and the Ohio Health Department will take action as needed. Although this will not be an overnight occurrence, it is the beginning of something big. By disclosing all hospital prices in machine-readable format in dollar amounts, tech developers will be enabled to create shopping tools. Think of an Expedia or Google Flights for healthcare, where a patient can easily search for an MRI and see different prices, where the same MRI can be $12,500 or $400. This is a real example in my own family, and there are countless more out there. This will empower consumers and employers, lead to price discovery, and create competition. And competition makes everything better, and competition makes America great. And with that, we're open for questions.
How long will it take for all hospitals to be required? I mean, they've been probably preparing for some time, but how long till they have to have all their prices listed on their site?
Yeah, so after when the bill takes effect tomorrow, the expectation is that that they would have them up tomorrow.
Okay.
There's a 60-day window of time that the Department of Health will ultimately have before they start issuing reports. And then, so sometime probably over the summer is probably when you'll really see that first report. And then every 30 days after that, that report's expected to be updated.
And how will the Department of Health hold these hospitals accountable? Like, what will be their penalty if they don't post these prices?
The bill outlines the penalties, and they start off slow, but they do go up quite quickly, exponentially. So we'll give them their period of time to reconcile their files and bring them into compliance. But yeah, the first violation is more of a slap on the wrist. But if they're not compliant after that original period, it could escalate pretty fast. And then the tech developers, we're going to need full compliance, so we have all the data that they can bring a vibrant suite for Ohioans to shop for their health care.
And I'll just add to that what this actually did was went a little bit further, but it codified an executive order from President Trump, and it actually was put in at the end of his first administration. Joe Biden, during his presidency, kept that executive order. So if hospitals are in compliance with the federal order, they should be good to go tomorrow. So this is really just making sure that the state is stepping in and holding people accountable when the federal government seems to not be able to do the job.
Along those lines, you're probably familiar, former Secretary of State Ken Blackwell just wrote a scathing story that he talked about Cincinnati Children's, the Cleveland Clinic, which is using, I think it's 340B drug pricing program money to fund woke ideological work is what he would call it. And I bring all that up because there seems to be this arrogance sometimes to ignore the law. Do you have assurance from the Ohio Department of Health that they are actually going to enforce this if hospitals try to go a different direction?
you want to take that one?
During meetings, as we ran this bill through, they were in several times, and we're asking how that would look on our end, and we outlined the bill. So I believe they're aware, and they're going to be ready. The Auditor of State will have oversight as well, and be an annual review of them, of the Department of Health, and if they are enforcing this law. So I feel confident we have what's there, but what you said is true. There is an arrogance to go around this federal rule across the whole country. So, we can always go back to the apple and tidy this up a little bit, and I think we're ready to do that if we have to. Prefer not to have to do that. We just have a compliant hospital with pricing with the Department of Health doing their job, and then the auditor's office overseeing a clean report.
Have you heard from Ohioans yet? And if you have, what's the most exciting feedback that you've received from Ohioans about this going into Baltimore?
I think they're just excited that there's transparency and we've put light on this. It is a very, if you're healthy, this is no big deal. You're not going to be healthy your whole life probably, unless you're one of those lucky ones. So it's just once you get into the healthcare system and you've ever been in it, people tell me all the time, it's like, oh my God, I wish I had this last year or 2 years ago. So, I think they do. And I think the business community has a heck of an opportunity here to embrace this and change how all health plans are done, and they're going to have prices, and they have fiduciary duty. If you take $1 from an employee's paycheck, there's a fiduciary duty attached to that to be holding to that dollar and that go as far as one can in that plan. So I think there's a big opportunity, and we just got to get those data files complete and let the tech industry. Let Ohioans use it and Americans use it, because that's where the tires will hit the road.
Jack, I'm going to actually encourage Patrick to come up here and speak to it, because similar bills have passed across the country. Experts say that this is the strongest bill, but Patrick has seen those other bills in real time, and maybe you could say what the compliance has been like there.
Yeah, I think the hope is that there's not a single fine issued, but the bill does outline the different fines the different hospitals will face depending on their size. So that's the hope, that they don't. But I think ultimately, what's going to get them into compliance is knowing that someone locally who's actually keeping their eyes on them, just not some federal government that's out in the distance that may hit them, is going to get them into compliance. I actually passed, when I was a former legislator in Colorado, a very similar bill. And it's led to tech developers doing exactly like I mentioned, where they're developing these tools. One of the things I didn't do when I was a legislator, looking back 2.5 years in hindsight, is I didn't codify the rules. I just referenced the federal rules. And those were rolled back in the previous administration to allow algorithms to be posted in the files instead of real dollar prices. That's what makes this bill so powerful. What I got wrong, they're getting right. So what's happened in Colorado, you could actually go and shop, but it'll give you an algorithm, and that does you no good. So by them actually outlining it clearly that they have to be posted in a dollar amount, I think is going to be very powerful for the consumers.
Just to kind of talk about Patrick and his efforts around the country, they're running these bills in 15 states right now. And we have the strongest one. So I think Ohio, we don't usually lead on things like this, but I'm very proud that we got this done, that we can lead, because generally these laws will go through the Midwest and sprout out across the country. And I think the most important thing is we're giving the feds some cover that we care about this, and then it'll give them the ability to start their enforcement efforts as well, because we just want to have that dual enforcement so Ohio can do what it has to do in case the feds don't do it, and not many of us probably believe the feds are going to do a great job at this, so we just might as well own it and do it ourselves, right?
Are they allowed to post a range? Because I would imagine that some hospitals, doctors would say, well, it depends on what we deal with when we get there, when we get into the patient, because all patients are different. So are they allowed to post a range, and how do you deal with that?
So they have to post a price based on every CPT code that they offer. So in the situation that you just outlined, there may be a situation where, say I go in for a knee repair and something happens with my heart. So when I first went in, of course, they had the CPT codes outlined for what they needed to do for my knee. Now, if there's extra stuff, there would be different CPT codes that would be attached in that case. But those would have to have been posted prior as well, because they're offered within the hospital. And what that does for the consumer is it actually makes the market start working. Because what we're seeing sometimes is some of these prices are 32 times the difference, up to literally 32 times the difference, between different systems, and in the same system it can be 10 times difference. So a normal consumer, as the market starts actually working, you're going to see those start to come into line, or you're going to have price convergence. And so even in the case where you do go in and it's an unexpected or an emergency surgery, even though nearly 90% of surgeries and procedures are pre-planned and without complications, for those 10%, it'll still actually make it work, so that we can't have the 32 times price difference, because the market just won't allow that to happen. It's similar to a gas station. You might see, for convenience reasons, one could be even up to 50 cents higher per gallon, but you're not going to see a difference of 32 times difference in a gas station or in a grocery store or any other market. It's only in healthcare where we don't have prices that the market's not working.
You kind of expound on that. When you have a non-emergency service that's, it's not life or death, you can plan it out. You're going to do a pre-authorization of what's all needed in that surgery. Then if something comes up, as Patrick said, it goes into an emergency situation, and our bill is not, it requires them to post them, but they have these protocols and treatment plans that they can deviate from to take care of the emergency. So this bill does not restrict any of that. And it's just if someone wants to have a planned surgery, get a knee replacement, get a knee surgery, you get that thing pre-authorized. We can have the price in dollars and cents the whole way through if it goes smoothly. If it doesn't go smoothly, then they'll have additional charges because of an emergency situation or something that deviates off the treatment plan or the pre-authorization that was already there.
One thing that I also, I guess, I'll pitch a question for you, Marnie, is you do work all across the country. You do a lot to try to help patients. For you, what is it like, or what would it be like in a state like Ohio, where you have a law like this on the books, compared to a state where there is no hospital price transparency and you're trying to help somebody?
Well, we've been trying to lean on the federal rule, which, as we've learned, is not helping because of the enforcement and lack of it. And I feel that Ohio has a hammer that can really come down on these hospitals and get them to come into alignment and post their prices. Hospitals aren't going to do this willingly and with great joy. But to Patrick's point, I think what we can look forward to is once the hospitals are forced to post their prices, they're not going to make it all easy to find, but they'll be there. Then we have independent aggregators who will take that technology, and pretty soon you'll be able to look on your smartphone and say, if you need your tonsils out, what is it going to cost? And it's going to be hard numbers, and you're going to be able to shop for that just like you would shop for airline tickets. And it's going to take a few steps and a few iterations, but this is a huge first step. We have a law, and we have enforcement. And we have real prices, not estimates, not formulas, not algorithms. And once we get those real hard numbers in place, then we're going to have something that we can really work with.
And also, the other thing that you have seen with hospitals that have been in compliance with the federal law and attempt to be good faith actors, it's really not fair to them that here they are posting prices and trying to actually play by the rules and in the marketplace, and you have hospitals that aren't, that are getting an unfair advantage because they can give estimates that just aren't reality. So that's the other thing that this does, is make sure that everybody is really competing with those good faith actors. Any other questions? Will all be available outside of this otherwise? Well, I would just say thank you so much to Marnie, to Patrick, to Tim for all their work on this so far, all the organizations that helped us outside of here, the representatives and senators, both past and present, that unanimously voted for this, Governor DeWine, that without hesitation signed the law, and I really look forward to this serving the people of Ohio. Thank you all.